Hey everybody, welcome back to class. We have now come to module number 4, Behavior Theories Applications Part 2. I hope that you're doing well. Real quickly, just a word of announcement, just a heads up if you've not already caught this from looking at the class syllabus or looking in the module this week, you have a case study that's due with this module in addition to the normal homework assignment. So of course, with every module, you have a homework assignment due at the end of the second week, and that's true with this module, but also too, before you do quiz or exam number 2, there is also another written assignment, the behavior theory case study that's posted for you in the module. It's also posted in the assignment section of the class. So don't forget that. Go and grab that. Everything you need for the case study is provided for you both in modules 3 and number 4. So you may have to kind of go back and forth between those two modules as you are doing the case study. But I hope you're doing good. Hope you're doing well. You know, we talked last time about how every single theory that we study as students, every helping approach, that's what a theory is. A theory is a helping approach. And every theory that we study has two sides of a coin, or two parts of it. It has the core beliefs or values. What does the theory say or teach about human nature, problems, change, the role of the helper, all that kind of stuff, right? And we did that in modules 1 and 2. We talked about the core beliefs of this helping approach called behavior theory. And what we're doing in modules 3 and 4 is we're looking at the other side of the coin. And that is, how do we take those core ideas and then use them and apply them, the application of the beliefs in our work as helpers, as counselors, drug and alcohol counselors and therapists, as caseworkers, outreach workers, advocates, whatever it is we're doing. How do we take the basic ideas of this theory called behavior theory, and how do we see them at play out there in our world today? And that's what we're doing in module 3 and number 4. Module number 3, we reviewed, I gave you very, very quickly. We could have gone on and on and on and on. There's so many different examples we could have talked about, but we talked about 4 basic approaches or applications. We talked about modeling and shaping and token economies and extinction. Those are just 4 really simple examples, application examples, so to speak, where we see the core concepts of behavior theory at work in our world. And in this module, module number 4, we're going to look at 2 general, really general other examples, relaxation training and exposure therapy. And so those are 2 really broad terms. The term exposure therapy, the term relaxation training are 2 very, very, very broad terms. But they really are 2 great examples of where we see in our world today, in the helping professions today, where we see the basic concepts of behavior theory and behavior modification at play. Now, relaxation training and exposure therapies are different, but they're related. Here's one big way they're related. We tend to use them with one population or with one general kind of client population. And it is when we are working with people who have anxiety, who experience stress or fear or worry or panic. Some of you have already been in the abnormal behavior class, and you're familiar with this idea of what we call an anxiety disorder, and the fact that all of us experience stress and worry and anxiety. We live in a world that is stressful. We live in a world today where it's just a normal human emotion to be afraid sometimes, to be anxious or stressed sometimes. That's not in and of itself unhealthy or wrong or negative. That's just a normal human emotion. A lot of times our anxiety is good for us. It keeps us on edge. Sometimes it helps us to protect ourselves and not put ourselves in dangerous situations, for example. But we do know that there are a lot of people, children, adolescents, and adults, who really struggle with anxiety. Their anxiety and their worry and their fear rises to the level to where it really becomes disruptive for them. It becomes distressing for them. It is outside the realm of typical or normal. It kind of becomes unhealthy, we would say. And if you're going to work in the field of social services, I'm just going to give you a heads up, you know this already. You're going to work with a lot of people of all ages, of all walks of life, of all ethnicities, of all backgrounds, who really struggle with anxiety. Anxiety has many different faces. Sometimes it comes out through just our fear and being worried and stressed all the time. Sometimes it affects our sleep. It's one of the ways we sometimes know that we're stressed, or we have a lot going on in our lives, is we don't sleep well. It affects our appetite and our weight. Sometimes anxiety shows itself as people have panic attacks, or they have really strong, severe fears, things that they are afraid of, like a phobia. They may even, at some level, maybe struggle with like obsessiveness and impulsiveness, and that might even rise to the level like a disorder, like obsessive compulsive disorder. They may have experienced a traumatic event, And as a result of that traumatic event, now they have nightmares or sleep problems, or they have avoidance issues or irritability issues or whatever we call post-traumatic stress kinds of problems. Anxiety can look a bunch of different ways. And when you and I work in social services, we have to be prepared to know how to sort of address and help people who struggle with anxiety and stress. And it's something that all of us are familiar with. None of us is free from the experience of feeling worry or stress or fear or anxiety. And so we all know it's personal to us, but also too from a professional standpoint, we need to know how to work with people who have anxiety and different problems. Now here's kind of the thing. Here's how that relates to this class. Anxiety is not just an emotion. We think about anxiety as something like more like an emotional kind of a thing. Well, our emotions affect all parts of us, right? So anxiety is an emotion. Yes, it is. It is an emotion. It's fear, worry, stress. Um, but anxiety is not just an emotion. Our anxiety affects how we think. It affects our cognitive behavior. Remember that term from module number 1, right? Um, Anxiety affects our anxiety affects how we think and look at the world, and vice versa. How we look at the world affects how we feel. So it's a two-way street. Our anxiety also affects our outward physical behavior and choices, and vice versa. So it's a two-way street. But the emotional experience of anxiety affects our cognitive behavior. It also affects our outward physical behavior. And that's where relaxation training and exposure therapies come in, because these are more behavioral approaches, but we often use them and we see them oftentimes in our work with people who have anxiety, stress, worry, and those kinds of things. So just really, really quickly, so in this little video, we're talking about relaxation training. And in the next video, I'm going to summarize 3 really, really simple, we call exposure therapy approaches. But let's talk for just a minute or two about relaxation training. My hunch is you probably have had an experience like this. About a year ago, I went down into Houston on a Friday. It was a busy, hectic time in my life, busy time of the semester. I had to get up early on a Friday morning and fight the Friday traffic going down into downtown Houston to go to a seminar, a professional seminar in downtown Houston. And I was going down there to hear a lady talk actually about post-traumatic stress. Was kind of really the topic. I was very interested in that, how it affects veterans, especially, but not just veterans. I've always had an interest in PTSD, and so I signed up for this seminar. It started at 8:30 in the morning on a Friday. So I got up and fought the traffic, got down there. Parking was a hassle. I finally found parking. I got there at the last minute. A big old room full of probably about 100 different therapists and social workers. The lady got up to do the presentation. She was from one of the medical schools down in downtown Houston. Very, very credentialed, experienced person who works as a clinical social worker and with people with post-traumatic stress. She got up, got her PowerPoint presentation. I was ready to listen and take notes. Here's the first thing she did. She said, before we get started, I want everyone to do this. She said, I want you to close your eyes. I knew as soon as she said that where she was going. She said, I want you to close your eyes. She said, if you're comfortable, I want you to close your eyes. And she said, I want you also to. She said, if you are comfortable, she said, if you want to slip your shoes off, and we were sitting in a big auditorium. Now, I didn't slip my shoes off, but both of the people next to me did. They slipped their shoes off kind of discreetly. She said, I want you to sit in that chair until you're comfortable. Find a comfortable position with your eyes closed. And I knew what she was going to do. And so so here we are, all of us as professionals. I did that, closed my eyes, got kind of comfortable. And she, in a very calm, quiet voice, said, I want you to pay attention to your breathing. And so I want you to make a note. Is it fast? Is it relaxed? Is it slow? Well, as I paid attention to my breathing, it was fast. Now, I didn't realize it, but I just come in, I'd rushed in, and my heart rate was up and beating, and I was kind of focused on something else. Well, when I focused and got quiet and focused on my breathing, I realized I was kind of out of breath. And she said, if your breathing is too fast, I want you to slow it down. I'm going to give you about 30 seconds, 60 seconds to breathe in real slow and hold it for a second, and then breathe out real slow and hold it for a second. Slow yourself down, calm yourself down. So I did that, and I kind of needed to do that. I'm kind of glad she had us do that. And I began to calm myself down. What I was doing was calming my body down through my breathing, right? And then she said, I want you to do this. She said, I want you to pay attention to your thoughts. She said, what's rattling around in your head right now? I want you to pay attention. What do you got going on in your mind this morning? She said, my hunch is probably a lot of us, it's been a busy week for most of us. My hunch is your mind's going 90 miles an hour. Mine was. She said, I want you to do your best to intentionally clear your mind if you can. I want you just to listen to my voice. I don't want you to worry any anxiety, any worry. I want you to like to just visualize yourself, just clearing it like you're sweeping out a room. You're sweeping it out and you're getting rid of all your stress, all your anxiety. Keep that breathing. My breathing was real slow now. And man, I was just kind of relaxing and kind of calming down a little bit. He said, I want you just to focus on my voice. I want you just to relax. We're going to have a great morning. We're going to learn a lot. She's talking kind of real small, real soothing, real soft, right? And she said, there's nothing more important this morning than being right here. Whatever you got later is going to be waiting for you. Don't worry about it. And she kind of got us all calmed down, all got our mind clear and focused. And after about, I don't know, it felt like a long time. It was probably like 3 or 4 minutes. She said, all right, open your eyes and let's get started. And when she did that, I felt like totally chilled out. I mean, I had gone in about 5 minutes. I'd gone from my normal state, which is kind of on like, like most of us. I was kind of there. I kind of been rushing. And she just threw a very, very simple, we call it a relaxation training exercise. Really simple. I mean, it wasn't complicated. It was deep breathing and what we call mindful meditation or guided or grounding. We call grounding. We'll talk about that here in a second. Through the intentional, sort of sweeping out the thoughts, she got all of us focused and calmed down. Maybe you have done some of that before. Maybe you do yoga, or maybe you've learned what we call mindful meditation, or maybe you've been in a class before where someone has done exercises like that. I really appreciated her doing that because that really is one of those skills. That example is something that we use a lot in counseling. She was a counselor, clinical social worker. And one of the things that I learned when I got into the field many, many, many years ago as a clinician was how many times I had to get people kind of grounded, we would say. They come into a session with me and they're all wound up, right? They got a bunch of stuff going on. And they got a bunch of stuff that they're stressed on. And I had to learn very, very quickly. Fortunately, I had good supervision as a clinician in the early days. And I had a good supervisor who taught me, I'm going to show you one of them in just a second, 2 or 3 really, really simple relaxation training techniques and exercises that I could do both in my own life, but also too with my clients. And that lady down in Houston about a year ago did that with us. And what she did was she did some deep breathing kinds of things with us and some mindful meditation. And what she was really doing was she was helping us to behaviorally take intentional control of first our breathing and then our thinking as a way to calm it down. And guess what happened when we did that? It calmed our emotions. It calmed my emotions down. So the idea with relaxation training is this. Sometimes we can calm and soothe our emotions of anxiety by first soothing our thinking and our body or our breathing, most often our breathing, not always our breathing, but relaxing the body first, relaxing the mind as a way to then calm and soothe the emotional side of us, anxiety. That's what relaxation training exercises are. There are a bunch of them. If you were to go onto Google today and Google relaxation training exercises or techniques, there are hundreds of them. They've been around for a long, long time. If you're going forward in this class or in our program, and you want to be a clinical professional, you want to be a licensed drug and alcohol counselor or a therapist or a counselor or something like that, you're going to have, I'm just telling you right now, you're going to have some relaxation training techniques in your toolbox, some things that you have learned how to use maybe in your own life, and you got to have them at the ready for the client who's having a panic attack, for the client who tells you in a session that that their mind can get out of control and their anxiety can kind of get out of control at times, that they're stressing and worrying over an exam that's coming up. And you want to teach them and help them learn some self-management skills of how to manage that anxiety and that fear in the moment and how important that is. I give you in your lecture notes, because again, this video is just kind of a summary of our lecture notes. I give you in your lecture notes 3 really simple examples of relaxation training techniques. These are not the only 3. These are 3 real basic ones. There's a bunch more. But let me give you just a real quick overview. I have this in your lecture notes. Also in your PowerPoint as well too. 3 really simple examples of relaxation training techniques. The first one is deep breathing or breathing exercises. The example I gave you a minute ago, this lady down in Houston, is an example of that. There are a bunch of different deep breathing activities and exercises that you can use. The idea behind deep breathing, I just mentioned this, is this. When you and I are stressed and anxious, we don't realize it's part of our fight and flight, autonomic nervous system, kind of how we're wired just naturally, physically and psychologically. When we're stressed, our body is getting ready to fight. And we don't have to make that happen. It naturally happens. It's part of what's called our autonomic nervous system. It is instinctual. So when we are stressing over something or worried over something, our body believes there's a threat out there. And it naturally begins to get us ready to respond to that threat, to run away or to fight. So what happens naturally is our muscles get tense naturally. And what happens then is we begin to breathe more shallow and our heart rate begins to pick up. And what happens is it's our body's way of kind of getting ready to fight or flight. Well, the problem is most often we don't need to fight or flight. If you're stressing over an exam, you don't need a fight or flight. What you need to do is just be prepared to kind of be focused to deal with it. But our body doesn't know that. So relaxation, so deep breathing is a behavioral technique where the person, like I just described a minute ago, intentionally focuses on their breathing and usually slows it down, making it deeper to where we're taking in more oxygen into the lungs. We're expanding the lungs. We're expanding the diaphragm muscle at the bottom of our lungs. One of the largest muscles in the body is the diaphragm at the bottom of our lungs. And when we're breathing real short and when we're kind of anxious, well, then our lungs are kind of constricted. That diaphragm is real tight. Well, if we can intentionally begin to fill our lungs with oxygen and expand our lungs and expand that diaphragm, what happens is it begins to slow our heart rate down because our heart is working less hard, right? And so we have more oxygen, we begin to feel better. And so it's a simple way to soothe our both cognitive part of us and our emotional part of us is to soothe the body first. And so deep breathing exercises are very, very, very simple, but they're behavioral. They're an example of a behavioral application. The most basic one of the most basic deep breathing activities is called boxed breathing. I have a handout listed for you in the module this week of the one that I use. Now this is just me. This is the one that I was taught many, many years ago. And it's the one that I have used many, many times in my work with people. It's called box breathing. And so it has this visual of a four square, like a square box. And basically, what it is, and usually when I use it with people or with clients, I will take my hand and I will say, I will have them relax. If they want to close their eyes, they can. And the idea with box breathing is kind of like the lady did with us down in Houston. You get a person to relax themselves and wherever they're seated. They could also do it standing up, but it works better if you're seated. They close their eyes, and the idea is they inhale through their nose for 2 or 3 seconds. So you do inhale, 2, 3, hold, 2, 3, exhale through your mouth, 2, 3, rest, 2, 3. So there's this idea of a box. Inhale, 2, 3, hold, 2, 3, exhale through your mouth, 2, 3, rest, 2, 3. Let's do it again. Inhale, 2, 3, hold, 2, 3, exhale through your mouth, 2, 3, hold, 2. So it's the idea of a box breathing, real simple. Now here's the thing with box breathing. If you ever try it on yourself or someone else, it takes a little bit of practice. Here's the thing. You don't want to go too fast or too slow, right? If you go too fast, people are going to hyperventilate and pass out, right? If you go too slow, then they're also going to pass out, right? So just real simple, real relaxed. And you can do that for 7 or 8 or 10 different little cycles. And I use that as an example. I use it sometimes in my own life. I've used it before in clinical settings many, many, many times. It's a real simple, it's not the only one, it's a real simple example of a deep breathing activity where people are taking in, new oxygen, expanding the lungs. They're holding it to make our lungs kind of stay nice and expanded. You're exhaling through the mouth. You're kind of deflating the lungs, and then you're holding and resting, right? So box breathing is a really, really simple example of a deep breathing exercise. We're also going to see, by the way, in the next video, we're going to come back and talk about relaxation training, deep breathing again, because we oftentimes use deep breathing activities with exposure therapies. I also mentioned to you in your notes 2 others, what's called mindful meditation and grounding, and guided imagery. So very, very quickly, and again, you can learn a lot more about these online. We hear a lot today about mindful meditation. Mindful meditation is kind of what the lady down in Houston did with me and my group and my class, where she said, pay attention to your thoughts and do your best if you can to get rid of, to kind of clear out the clutter and get kind of grounded in the moment. I want you to, so sometimes we'll say, I want you to pay attention to your body and how you feel. I want you to feel yourself while you're breathing deep, sitting in the chair. I don't want you to worry about what happened yesterday or earlier this morning. You're not worrying about 2 hours from now. You're right. You're present in the moment. We call grounding. Because what happens when we get anxious is we oftentimes start worrying about something later or something from the past. And grounding is a way to kind of get grounded in the moment through just getting people cognitively to think about where they are, how they're feeling, how they're thinking, what they're sensing. We sometimes ask people, what are you smelling right now? What are you feeling right now? Don't worry about earlier. We'll talk about yesterday in just a minute. We'll talk about tomorrow, but let's just sort of get focused on right now. What we call grounding exercises or another behavioral relaxation training approach or mindful meditation, getting someone to kind of clear their mind out as best they can or focus on someone's voice as a way again to soothe kind of the anxiety, to soothe our thinking. Because again, whenever we get anxious, our mind gets really fast and our thoughts get really, really fast. And that just contributes like a snowball to our anxiety. So learning to kind of control our cognition, our visual imagery is kind of what mindful meditation and grounding are all about. And kind of similar to that is guided imagery. Guided imagery is kind of a little bit the opposite of mindful meditation. Guided imagery is where you have people clear their mind out and then think of something specific or different. Sometimes we call it a distracting technique or a cognitive redirection technique, where you instead of having someone stress or focus their mind on everything going wrong, you have them focus on in their mind, they visualize a picture in their mind of a peaceful place. They visualize in their mind the picture of somewhere that of them doing something successful. You have them visualize themselves the picture of a person who they love and care about. So with guided imagery, you're having them actually, you're guiding them to imagine, guided imagery, guiding someone to imagine in their mind certain kind of techniques, certain kind of images, or certain usually positive images. You're having someone think through peaceful examples, visualizing themselves being successful, positive behavior, pro-social behavior, those kinds of things. So those are all they're all related to each other, but they're all kind of different. With both mindful meditation and grounding and guided imagery, we usually use relaxation training like deep breathing first. We can get people relaxed through deep breathing. And then from there, you can stop right there. You then can add to it mindful meditation or grounding activities, or you can use guided imagery. All kinds of examples and ways that we use that. We have a lady in our program here in the Human Services program. She's one of our adjunct instructors, and about a year ago or so, she and I were visiting in the hallway about her own private practice and the work that she does as a licensed therapist. And she and I were having a good conversation about both grounding and guided imagery. And she said, I use a lot of that with my clients. She said, especially with anxiety and with post-traumatic stress and people who've had trauma. She said, a lot of times, one of the things I try to teach my clients is ways to kind of manage themselves and manage their emotions. Instead of letting your emotions and your mind and your body run out of control, learn how to take control of that. And she says, I use a lot of grounding techniques. I use a lot of guided imagery to help people to visualize in their mind. Instead of this, visualize and focus your mind on this. When you find yourself thinking like this, I want you to sort of catch yourself when you're thinking like this and instead try to flip a switch and flip your mind and flip your focus to something else. Instead of this. And that's sort of an example in a way of guided imagery in a way. So those are just three really, really simple relaxation training techniques: deep breathing exercises, mindful meditation and grounding, and then guided imagery. Really, really, really simple. A lot more we could say, but really simple. A lot of that many of you I know are already familiar with. So in the next video, we're going to kind of talk a little bit more about deep breathing, because we're going to talk about exposure therapies, and we're going to continue our conversation of how we apply behavior theory concepts, and we're going to continue our conversation around stress, anxiety, worry, fear, because that's kind of where the exposure therapies come into play as well too. Okay, so come back and watch that video, look at your lecture notes as you get ready to do your homework and your case study, and I will see you next time.